So I'm gonna gather my supplies before I get ready to hang the primary tubing. I have my tubing, it would typically be in a bag. I'm gonna have my saline flush so that I can flush my IV, make sure that it's patent, it's working. And then I'm also gonna have alcohol prep pads to clean the hub and my solution that I'm giving to the patient. Obviously I'd come in, wash my hands, introduce myself to the patient, tell them what I'm giving, and you would wanna scan off this medication in your MAR prior to administering, obviously, always, always. So we gathered our supplies. I'm opening my IV tubing set. Like we talked about, I'm closing the roller clamp and I am maintaining these caps. The blue cap on the end that's connected to the patient and the clear cap that's on the end of the spike are gonna stay on until you're ready to hook them up to their respective places, okay? I'm gonna remove my fluid from the bag. All of yours in the hospital will have some sort of bag over top of it. So now with my roller clamp closed, what they mean by remaining sterile is just making sure that I'm not taking this cap off and like getting my grimy fingers all over it, okay? So you take the cap off of your IV tubing, the cap off of your spike, and then you go right in there, and usually twisting helps, and then you will squeeze this chamber to get it between 1/3 and a half full. So somewhere around there. Now we do the actual priming. During priming, leave this on because you don't want it to touch anything except for the hub of your cleaned IV. So in order to let this flow, I want to make sure that this clamp is open. It won't flow otherwise. And I'm gonna use my roller clamp to determine how fast my fluid is gonna flow through my lung. These little hubs, what you can do is invert them when it comes time for the fluid to pass through so that any air that's trapped in here will escape during priming. So I'm gonna open my roller clamp. Oh, I literally told you to unclamp this and I didn't do it. Okay, what? Why would this not be flowing? I'm gonna use a brand new one. I don't know why this one's not flowing. So this would be what you're gonna actually do with any bag that's open.
Okay.
You're gonna have to spike it upside down. And then turn it right side up and get your fluid into the chamber. There we go. Then I'm gonna invert these up. And then it has reached the top here.
mind going back to that last slide super quick?
Oh, yeah.
Thank you.
Can you see?
Yeah, sorry.
All good.
Got it.
So you wanna make sure that your IV tubing has no bubbles in it, because otherwise it will infuse into the patient. If you do, you can, continue priming to get that air bubble out. You're gonna clean the hub of your IV for 15 seconds with your alcohol prep pad that you brought with you when you started. You will connect the IV tubing, maintaining sterility. So this is when you can take this blue cap off and connect it to your hub of your IV. Then we're gonna load our IV tubing into our pump here. So for these pumps, you take the blue cap and it's gonna go in there to pop your door open. It'll show you loading the set. So you're gonna put it through, close your door. It's gonna say new patient. Yeah, it's a new patient. SimLab, yes. And then I think we have to do basic. You're gonna select primary or secondary, and it's a primary bag. Okay, so say I wanted to run this whole liter over an hour. What am I gonna prime, or what is my volume to be administered? And then what would my rate be?
How long did you want to do it for?
1 hour.
Your rate was 60,000 mLs per hour.
Yeah, super easy. Now, these pumps won't let you put in 1,000, so we always put in like 999. And then it will calculate your time when you put in the volume and your rate. So then you can kind of check yourself, right?
So for competency, to like check up on this, do we have to do the math first? And then before putting it in the pump? Because the pump's gonna tell us what it is. Just like for, I guess, like our skill check, are we being tested on that to figure out like the calculation?
Yeah, I would know beforehand, but especially for like a primary infusion, this would be like considered a bolus. It's pretty easy math. It's not the drip rate that you're being asked. So like 1,000 over 2 hours would be divided by 2. So 500. 1,000 over 3 hours would be divided by 3. So you're just dividing it by the number of time, the number of hours they want it. And then think of it as like multiplying when it comes to less time. So 1,000 over half an hour would be 2,000 an hour, but you can't do that on the pump regardless. But say you're running 500 milliliters over 30 minutes, that would be 1,000, so you double. Make sense?
Yeah.
Kinda, sorta?
Mm-hmm.
Okay, cool, and then you're gonna hit run and make sure that your clamp's open, 'cause that's what it's saying, downstream occlusion. And there it goes. And then I also have the cap on, so it's yelling at me, but okay. I just don't want it to go everywhere. Makes sense?
Yeah.
Yeah? Questions? Let's practice.